If your doctor told you to start exercising for your diabetes, but you're not sure what to do, keep watching this video. I'm going to break down the cardio and the strength training guidelines for people with type 2 diabetes and discuss some of the potentially confusing part of the guidelines. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. The exercise guidelines that I'm going to be going over today, they were published in a consensus statement by the American College of Sports Medicine, or the ACSM, back in 2021. Now, there's a lot of different types of exercise and physical activities that can help to improve diabetes, including glucose management, but we know the most about structured exercise because that's what's been studied the most in research. The first type of exercise that I want to talk about is cardio, or aerobic exercise. So this is going to be continuous movement of large muscle groups in a rhythmic way. This is going to include activities like walking, jogging, biking, swimming, dancing, rowing, and similar types of activity. The intensity that you want is going to be anywhere between moderate to vigorous. So with the moderate, you want to make sure that you are breathing harder than you normally would. And to stay in moderate, you can typically carry on a conversation with somebody. If the intensity starts to get so high that you can't carry on a conversation, that likely means that you're working at a vigorous intensity. As I start to talk about how long you should exercise, how many days a week you should exercise, and other programming recommendations, keep in mind that you're not supposed to be hitting all of these recommendations in week 1, and maybe not even week 4. You need to start off light and start off slow and gradually build based on where you're currently at. You want to make sure that you're doing cardio anywhere between 3 to 7 days a week, and you don't want more than 2 consecutive days to pass without doing cardio. If you mainly do moderate intensity aerobic training, then you're going to need a minimum of 150 minutes per week, and each exercise session should be at least 10 minutes long. Now, if you mainly do vigorous cardio, like high intensity interval training or HIIT, then the minimum amount of minutes that you need each week is going to be 75 minutes. And you can do a mix of different intensities, so getting some of your minutes each week from moderate and some from vigorous. You can progress in your program by gradually increasing the intensity of what you're doing, the number of minutes that you're spent doing cardio, and the number of days per week that you're doing this type of exercise. If you follow just these recommendations without making any other changes to your lifestyle, in most people, they'll see a reduction in their A1C by about 0.5 point or 0.75 point. If you have other health conditions that prevent you from getting in these minimum recommendations for cardio, then just do whatever your physical and your mental health allow you to do. Please hit like and subscribe if you're finding this useful. The next type of exercise is strength training or resistance training. And this type of exercise involves pushing or pulling against some type of a resistance as a means to increase muscle strength and muscle power. This can be done with free weights, machine weights, resistance bands, and also body weight. Similar to cardio, the intensity is going to be anywhere between moderate to vigorous. Now, even if you're doing moderate intensity resistance training, the set should still be really challenging. Here's what I mean. Intensity for resistance training, it's typically expressed as a percentage of 1 repetition maximum, or 1 RM. And this is the maximum amount of weight that you can lift for a single exercise for 1 repetition using correct form. A repetition or a rep, this is just one complete movement in a single exercise. So it would be like going down and then standing back up in a squat. That would be 1 rep. If my 1 RM for a bench press is 100 pounds and I want to do a moderate intensity of 60% of my 1 RM, so that would be 60 pounds, I might be able to do about 12 reps of that before my muscles start to fail. Now, the point here is no matter what the intensity is, whether it's a moderate intensity at 60% or a more vigorous intensity at 85 to 90%, you want to make sure that you're doing as many reps as you can until your lift starts to fail. So within about 1 repetition to failure. Resistance training should be done 2 to 3 days a week, and you want to make sure that you've got at least 1 day of rest in between each exercise session. You want to make sure that you're training all major muscle groups in each workout, and the current guidelines suggest including 8 to 10 exercises. Now, I noticed an inconsistency in the guidelines whenever I was preparing my thoughts for this video. They recommend a rep range of 10 to 15 reps, but they also recommend intensities up to 85% of 1 RM. If you're doing a true 85% of 1 RM, you might not be able to get past 6 reps because the weight's going to be very heavy. The heavier the weight is, the fewer reps that you're going to be able to do, and the more strength adaptations that you're going to have. There's been some research that's linked heavier weights to better insulin sensitivity and better improvements in glucose management. A more moderate intensity that tends to result in doing between 8 to 12 reps. This tends to be more effective at muscle building, which is really important for diabetes. Please hit the notification bell to be one of the first to know when my next video comes out. For progression, you first want to determine what rep range you're going to be working in. Let's say that I want to work with an intensity that allows for up to about 10 reps before my muscles start to fail and I can't do any more reps. Now, in the first week of this program, I'm probably only going to do 1 to 2 sets of each exercise. A set is just a series of consecutive reps. Once I'm able to get 10 reps of an exercise, then it's time to increase the intensity, typically by about 5%. The next thing that I'd want to do whenever it's time to progress is I'm going to want to increase the number of sets to up to 3. And I'd probably do this in weeks 3 or week 4. After this point, the idea is to continually increase your intensity, so add a little more weight every time you come in until you eventually plateau. And once you get to that point, then you're going to need more intermediate programming to continue to advance your muscular fitness. There can sometimes be overlap across different exercise types in terms of how our body adapts to that training. For example, if somebody hasn't been exercising and they decide that they want to start biking for cardio 3 times a week. Now, within the first few months of that program, they're probably going to see some increases in leg strength. But just because they saw increases in leg strength because they went from doing absolutely nothing to working their legs on a bike, that doesn't make the biking resistance training. It's still cardio. And similarly, if somebody hasn't been exercising and then they start resistance training, a high volume resistance training program can increase aerobic fitness, which is the main adaptation from cardio. But that doesn't mean that high volume resistance training is the same thing as cardio. Then we've got the holistic type of exercises like yoga, Pilates, Tai Chi. These types of activities are typically done to increase multiple areas of fitness and health, like increasing flexibility, improving core strength, improving mental health, and they're all really effective at improving diabetes risk factors too. In yoga, muscle strength can definitely increase, but it's not considered resistance training because there's not a way to effectively load the muscle to continue to see strength increases after a certain point. I know that it can feel overwhelming to try to understand everything exercise-wise that you're supposed to be doing for your diabetes, but the most important thing is that you just start moving and you figure out a way to keep moving, because it's going to be that consistent movement over time that's really going to make a difference in your diabetes. Now, if you are starting an exercise program, please make sure that you first speak with your doctor. Thank you for watching.